In an ongoing mental health education today, I thought it is important to discuss the life of a student who has faced uh, mental disorder, maybe depression. To take a typical example is someone who is in the university becomes depressed and he is about 17 or 18-year-old. Is treated for about 4 to 5 months, during which he is out of his studies. He improves to a reasonable degree and he is contemplating to go back to university and resume his studies. His illness is not a severe mental illness. It is neither very mild disorder nor a very severe disorder. It's a depression of moderate severity which has responded sufficiently. Now, students as well as parents both remain very anxious and worried about getting back to books or university. Now, it depends. Some of the students live alone in the university campus, others live in their homes with parents. Sometimes there are grandparents, and that's an extended family in India, which is very much common. Now, in this situation, most of the people involved play a positive and collaborative role. We know that psychiatric disorder is common in this age group. About 2% people face the problem of depression. Overall, about 15-16% people develop a psychiatric disorder. This is also the age when a psychiatric disorder appears for the first time, and this is also the age that is somewhere between 15 to 18 years, during which most of the psychiatric disorders develop. So even if someone has not developed a severe depression, the milder depression may be indicative of his high sensitivity or high vulnerability. This problem might have appeared secondary to any potential psychosocial or academic stress. But everyone does not come under academic pressure. There are people who are extraordinarily sensitive due to number of reasons, and those who develop academic pressure are again very sensitive to the and possibility of developing mental disorder is high. The psychiatric disorder is not very commonly identified in our country, and therefore the correct treatment and timely treatment is not available. Patients do not receive treatment due to a number of reasons, and same is the situation with our student population. Somewhere the facilities are not there. A number of times people avoid, even when somebody is aware about possibility of mental illness, they wait for an automatic and natural answer rather than going for a professional help. Now, these attitudes are not good. So, there could be a student who has not been treated and wants to go back to school, whereas there may be another student who has received treatment and wants to go back to the university. In both situations, the precautions advised are same, and the team of parents, student teachers, counselor, the caregiving team has to take responsibility of providing a good level of care. The objective of this exercise is to make sure that the symptoms do not relapse, and also make sure that the students get back to, to the capacity which they had before starting of the illness. The recovery, when it is satisfactory, it can still be poor in terms of limitations in social functions. So there may not be symptoms of depression, but there can be symptoms of fear, anxiety, avoiding interaction, not being able to attend the classes, not being able to concentrate. There are a number of situations which are a matter of concern. For example, psychiatric patients are more likely to develop suicidal ideation, and therefore this observation is necessary. So, as I explained, the responsible stakeholders are the students, parents, teachers, schools, infrastructure itself, and the peer group, which is most important. Now, they form a continuous dynamic group, and there should be exchange of ideas, meetings to thrash out the issues. This develops a better rapport and an ongoing observation. Parents come to know how a student is doing in the school, and vice versa. Peers have very strong role to perform, which is related to protection against bullying or aggression by other students, negative environment, you know, expressed emotions which could be very negative, issues around addiction, and of course issues around sexuality and relationship in grown-up students. So these issues, which are very important and well known, that to increase the symptoms even when disease has responded, the friends and peers should be in the loop to monitor and help the students who is undergoing problem of mental disorder. We have to also pay attention that what impact the illness has caused on life of this individual. What is his level of confidence? What is his willingness to continue to the studies? Is he having a severe guilt that he has undergone experience of mental disorder? Is he shy of interacting with friends? Is he avoiding the teachers, and is he avoiding his classes in order to be the number of other issues which about five collaborators are stakeholders. The first is the patient himself, the second, the parents, the third, peers, and the fourth is the institution, and the fifth is the teacher and counselor. Each one must cooperate and collaborate. The objective of this exercise of return to school is one, to prevent relapse and have a continued symptom control. And the second is to reach back at the level of studies which was present prior to the illness. So we want to gain back the same capacity which the student had before the illness started. Generally, there is not much difference, though both patients and parents feel that the mind has suffered and there might be difference in the level of performance. But generally, the level of performance appears affected because of other symptoms which are emotional and behavioral rather than intellectual and academic. Certain advice can be given and expectations can be discussed. For example, the first step is to do a proper assessment and to make a plan. So there are a number of questions like, is the patient fit to resume studies? If not, one should wait for a correct time. And the correct time can be decided jointly in consultation with the doctors, parents, and the patient. The second question arises, is the student willing to resume studies? If not, one should find out whether it is because of the illness or because of stigma of the illness or because of fear of falling behind from other students. The next concern is the environment safe to return? And if not, one should develop a crisis plan or rethink about resumption. The safety of environment means whether the teacher and counselors are able to monitor, are able to give an extra attention which is required and invest time to develop the plan, monitor it and execute it. Another question comes, is the school equipped for support? Do they have facilities for monitoring like counselors to talk to, leisure time activity and extra support for education? Is the care in community adequate? Or are there level of psychological and social support available? If not, one should ask the medical team to find out ways and means to cope up with psychological demands. Another question arises, how to assess? In that perspective, one needs to assess the progress in recovery, the personality structure of the student, availability of care and continuity of treatment. The psychiatric assessment includes whether the care is available in community or in domestic situation. Specifically, if there is continued supply of medication, whether parents can financially afford it, and the level of recovery that students has achieved. There are some psychological and social needs, and we should remember that there is some impact of the illness on social recovery, the way students will interact with other, their ability to do the task independently or requiring an extra support. So the impact of the illness that we call technically disability because of depression or other mental disorders. So one should assess if this is present or not present. Another important factor is academic assessment, as doctors and teachers decide how to liaise with the school, how to plan for examination, what kind of extra academic support the student has. There are certain decisions which family has to make. Are the parents available to monitor? Are both of them working? Can they take leave? Can they accompany or support the travel? Is the family single parent, nuclear family, or extended family, or living with the grandparents, or there is somebody who is medically ill or compromised in health? Many times situation will change if there is another person suffering from mental disorder. Peer group is extremely important. Their support is important, but an over involvement and pressure from the peer group is to be looked after and managed. Especially one should avoid bullying and getting into addiction and sexual misconduct. One should set well-defined and reasonable goals, which will include the major decisions like, can the studies be continued at all? If yes, when? Now or after some time? Can the student appear in examination or undertake the tests for the course assignment? Young age is the age of learning, experience, performance. And in this age, when people develop mental disorder like depression or severe anxiety, it becomes a barrier for their progress. Both students as well as parents are too worried about the question if whether the student or his son or daughter will return back to books or not. Mental illness among students in university or in college remains a major concern. This problem is increasing day by day and is becoming more complex due to social, psychological, and institutional issues. We must remember that number of psychiatric disorders make their first appearance in the age of 14 to 20, and therefore these students are highly vulnerable and remain at risk due to a number of reasons, whether it is due to genetic propensity, academic pressure, or domestic situations, or even personal problems. All students are very eager and all parents are in a hurry, and this is where we go wrong. Return to studies is an important decision, and there can be no generalized way of assessment. It depends on a specific case, and the professional team takes a decision to guide the patient. This discussion cannot be a replacement for specific advice given by a patient's doctor or other members of their team. When the patient returns to school or university, everyone needs to be concerned and be careful. The common mental disorders, depression and anxiety, etc., are found in about 5% of students' population. About 2% students do have a suicidal ideation thoughts, and about 7 to 8% in teenage develop depression. A lot of other statistics can be quoted, but the fact of the matter is there are some students who have undergone treatment, they have lived with the illness.